start us off.
Hi everyone, welcome to the webinar on the intersection of energy and health. As Sarah said, my name is Eric with NSHHC. We'll go ahead and get started. Also today you're going to hear from Tim Bernthal from the Washington State Department of Commerce about the Weatherization plus Health program in Washington. And then after that you'll hear about some case studies from Jamal at the Green and Healthy Homes Initiative. Just really quickly, a little bit about NSHHC. We are the member association for the state directors of the Weatherization Assistance Program, the WAP, and the Community Services Block Grant, CSBG. And we go out to states, we provide training and technical assistance, distribute management best practices, and then also we are the voice of those state directors in Washington. A little bit more about the Weatherization Assistance Program. Folks probably hear the term weatherization get tossed around a lot, but I'm going to be referring to the Department of Energy's Weatherization Assistance Program. It's the largest energy retrofit program in the nation. It's been going for over 40 years now. It's in all 50 states, DC, and 5 territories. So the program has really been around in improving energy efficiency in low-income housing, but it was also the foundation for sort of the larger home performance industry and a lot of the standard energy efficiency technology that's used in the industry today, whether they're infrared cameras or blower doors, really got their start in the Weatherization Assistance Program. So housing and health are inextricably connected, and that's something that members of the Healthy Homes community and this audience of this webinar are familiar with. Americans spend a lot of time indoors, and the condition of housing can really impact things like asthma, lead poisoning, slid strips, and falls. And there can be a lot of negative health outcomes associated with poor housing quality. And the Healthy Homes community really targets those with chronic illnesses, with the potential to have their conditions improved by improvements in housing. But what we're here to talk about today is kind of the missing piece, or what we see as sometimes missing piece of the equation, which is energy and energy efficiency. So I hope from the webinar today, you'll be able to take away 2 main points. That one, energy efficient housing and energy efficiency measures have some inherent health benefits. There's a lot of positive health outcomes associated with energy efficiency. And then number 2, that energy efficiency programs, particularly the Department of Energy's Weatherization Assistance Program, can be really effective delivery methods for healthy homes measures. So up on the screen are the 8 principles of healthy housing, from the National Center for Healthy Housing, and I'm sure a lot of folks are familiar with these, but a lot of these overlap very nicely with the measures of the Weatherization Assistance Program, the standard energy efficiency measures and services that are integrated into the program and have been for many, many years. So particularly looking at keep it dry, safe, well ventilated, contaminant-free, thermally controlled, these line up very well with what the Weatherization Assistance Program does, right? So when you talk about putting insulation in an attic and wall insulation, putting in programmable thermostats, you're keeping things thermally controlled. When you're talking ventilation, with the Weatherization Assistance Program, they go by the ASHRAE 62.2 standard. So there are ventilation fans in weatherized homes that keep things dry, keep things well ventilated. So the Weatherization Assistance Program is doing this in the low-income sector, and of course you've got private market rate contractors doing that across the spectrum in private homes. You've got utility programs doing energy efficiency and weatherization as well. So moving to some of the research. Anecdotally, weatherization providers knew for years that their clients felt better after weatherization, but there was a national evaluation done by Oak Ridge Laboratory, and it really quantified a lot of those benefits. So members of households that were weatherized had a lot of positive health outcomes associated with that. So better physical and mental health reported, less asthma and allergy symptoms, and of course some of that you can monetize, looking at $2.78 in non-energy benefits for every $1 spent on weatherization. And you can really quantify that per weatherized unit health-related benefits. So some really great and robust research there from the National Evaluation on the Weatherization Assistance Program. That research base has grown over the years. There is a lot of good research out there kind of really demonstrating and quantifying this connection between health and energy efficiency. So there's a few pieces of research here that I encourage folks to dive into if this is a topic that's new to you. National Center for Healthy Housing has been involved in a few of these. There's just a really good base of research that I think, if this is an area that your organization wants to get into, there's a lot of really good data points to really make your case to funders, to community partners. So really encourage you to take a look at these. From that second study there's a really nice flow chart that kind of outlines, the energy efficiency measures there on the left, their effect there in the middle, and then the associated health outcome on the right. So we can see through this that there are a whole variety of different health outcomes that are really tied to just improving the energy efficiency of the home. This is some information and a graphic from a recent evaluation in December 2018, very recent, from the Vermont Department of Health. It looked at a lot of the research out there on energy efficiency and health benefits. So I encourage you to take a look, and you can kind of see on the right here the strength of the evidence and how these different measures are associated with improvements in various different health conditions. So the long and the short of it is that first takeaway that the Weatherization Assistance Program, weatherization services, energy efficiency have some really inherent health benefits that can really make the home healthier and have some positive health outcomes. So that brings to kind of the second takeaway about the Weatherization Network and energy efficiency programs serving as a really good delivery method for additional healthy homes measures and really bringing healthy homes into more homes. So there was the Weatherization Plus Health Initiative, which was funded by the Department of Energy back in 2011. NSHHC, our organization, was heavily involved in that project, the lead on that project, and there were several conferences held throughout the country and really trying to disseminate the idea of a Weatherization Plus Health model, integrating healthy homes measures with the traditional weatherization program. So there were a lot of states and local agencies who were able to access that information and research and program models, and so we've seen a lot of that come to fruit over the years. Again, talking about the Weatherization Plus Health model, the traditional weatherization program really prioritizes the energy efficiency aspect. All energy efficiency measures must cost justify and have a savings investment ratio of 1, which essentially means that that energy efficiency measure must pay for itself over the lifetime of the measure in savings. And so, the health and safety aspect is almost secondary to energy efficiency. But looking at a weatherization plus health model, there are specific health and safety improvements that can really improve the quality of life of the resident of the home, and it can really be integrated and still achieve these energy savings for clients, but also make their homes healthier and get the health benefits that way. So one example is in Vermont. What Vermont has moved to is what's called a one-touch system, which integrates a lot of different referrals so that any government agency that's going in that home is using a similar tool, using the same tool rather, and they're able to do referrals and make sure that folks are receiving comprehensive services. And so in addition to getting their home weatherized, they're going to be connected with a whole suite of different providers to bring healthy homes measures into that home. You can see a great graphic here, really again outlining the enhanced weatherization aspect of this Weatherization Plus Health model versus traditional weatherization. I also want to use this to highlight what's called PreWeatherization Programs. This is another aspect of the Weatherization plus Health model. So some homes we know have issues that are too severe that make them not good candidates for weatherization. The weatherization measures would be ineffective in that sort of home, or might actually make it unsafe to put those measures in. So we have seen a lot of states, I've called out here in the slides, Indiana and Delaware. We've seen this in Pennsylvania, Ohio, a few other states as well, that have leveraged some really good other funding sources outside of the Department of Energy funds to address a lot of these health issues and larger structural issues, contaminants like mold, asbestos, radon, to make that home weatherization ready and then bring it into the weatherization program so that those Department of Energy funds can achieve those energy savings for the client. And then finally, after I've done that quick overview of the connection between energy and health, I want to turn it over to Tim Bernthal from the Washington Department of Commerce, and he's going to dive deep into how this is working on the ground with a statewide program in Washington State. Take it away, Tim.
Thank you, Eric. I'll have my slides up here in just a second and get started. My name is Tim Bernthal. I'm with the Washington State Department of Commerce Low-Income Weatherization Assistance Program. So we are one of the programs that Eric is describing as part of the state nationwide network. And today I want to talk about how we as a WAP, Weatherization Assistance Program, are trying to combine weatherization for energy savings with home and environment health interventions that will help households specifically with asthma or other respiratory conditions. So far, we believe that there's significant improvements in health and in reducing both energy and healthcare costs that come out of this approach that are worth further experimentation and study. Oops, just a second. So just a word about where this program is located. The Department of Commerce has a very broad mandate for basically strengthening communities through programs of economic development, community development, but also some of the traditional energy office functions, and that is the division in which the Low-Income Weatherization Assistance Program is located. So we've, as the rest of the nationwide Weatherization Assistance Program, have been around for almost 40 years and basically trying to run a program that brings energy benefits primarily, but with the addition of health opportunities as well, as Eric was describing earlier. So here's a picture of what the Low-Income Weatherization Program in Washington State involves right now. We produce about between 2,500 and 3,000 completed units a year around the state. Those are both single-family housing, owner-occupied or rented, and also multifamily housing. We operate through 28 different local agencies. Most of these are community action agencies, and a few of them are units of state government or city government, and a couple of them are housing authorities. So we have resources of between $20 to $35 million a year, several Federal funding sources, Department of Energy, the LIHEAP program, which provides both energy assistance and weatherization funding. The Bonneville Power Administration, EPA, because of where we are with hydropower in the Pacific Northwest. And the state of Washington is also a capital budget funder through a mechanism that also matches the utilities around the state to provide funding for low-income weatherization. That's our basic weatherization program. As we've become interested in experimenting with Plus Health, what we've added on to that is about 250 units of production a year, so 5 to 10% of our total output, that are focused on adding additional healthy weatherization plus health measures to our basics. We've done that through a year and a half of pilot experience that started in late 2015, and now in 2018 to 2019 involves an expansion to 14 agencies. The funding for that comes from the state of Washington capital budget program called Matchmakers. And the original funding we had access to is $2.3 million. In the 2018-2019 year, we have $1.4 million. And the addition of, besides matchmaker funds from the state capital budget, also access to LIHEAP funds to pay for part of our Plus Health work. So just a quick look at one of the realities that we live under, which relate to our interest in weatherization plus health and health measures in general as a service we provide. We're in an area that has low energy prices, basically. That's the good news. 80% of our electric power comes from hydroelectric, renewable resource, and it's also resulted in the second lowest retail price for electric energy for consumers in the nation. I think Louisiana is the first. So that's all to the positive. We have lower prices that low-income people have to pay for energy. But we also add on to that when we do our weatherization program, some built-in high energy weatherization costs. So most of our work is done through contractors. And by state law, we are required to pay them prevailing wage. The average wage for that particular specialty involved in weatherization for a county. And the result of that is basically that with low energy prices to start with, it makes it harder for us to get high amounts of savings to get high savings to investment ratios. That's the measure that Eric was describing of cost effectiveness. How much, what ratio of savings accrued in energy over the life of a measure are compared to the money you put into that investment. So with our challenges of getting that savings to investment ratio to justify our work based purely on energy savings, the idea of adding health benefits and being able to ensure that those are sizable and that we can find funding sources to help us pay for that allows us to explore further the medical benefits of weatherization plus health. So Eric showed you a couple of pieces of background studies that make the case for and help to quantify what those non-energy benefits, as we call them, the health benefits primarily, that a household receives when we make an investment in energy in the weatherization program. On the last slide, I have links to at least a couple of these so you can see some of the details later on if you're interested. But besides having a vested interest in expanding to medical savings as a service that we provide, we're also those CAP agencies, those community action programs, are very integrally involved in working with low-income people and bringing services to them that empower them. And being able to add these medical benefits has been just very well received, and our initial results we're getting really tremendous feedback from the changes that are being made in people's lives with their asthma, their ability to tolerate their indoor environment. And that's partly driving the enthusiasm that our agencies have, because they're talking frontline to people who tell them, you just made a major impact on my life. It's not as quantifiable as we'd like to have it at this point, but it really is a motivator, and we can see the value of what we're doing. So I want to talk for a couple of minutes just to show you the pieces of the service that we provide when we add Plus Health to weatherization. We start with traditional weatherization, which we spend a wide range on depending on the particulars of a house and their needs. It can be from $5,000 to $25,000, and this is what you would come to expect to understand this being a low-income weatherization services. It includes insulation, work on ventilation, new heating systems repair, air sealing, low-cost measures that help to make a house more energy efficient. And then on the top of that, we add about $8,000 maximum worth of specific healthy homes measures. These are based on an assessment for looking for the health conditions in a home that could trigger asthma or contribute to COPD, and looking through an analysis of what those measures might be in addition to our traditional measures that might help those folks, and includes things like changing from ripping off carpeting and replacing with a hard surface, doing advanced ventilation throughout the house, doing duct cleaning, roof repairs as needed, mold abatement and plumbing. And then on top of that, we have tried to add in an education component and some support measures that we spend money on that will extend the impact in a particular home. And we have two different ways of going about that. One is using our own resources to do energy and healthy home education, and the other is working primarily with community partners in a community health worker model to provide more personalized service and to get follow-up on results. And as part of that, working in the home, we spend roughly up to $800 on average for measures that are given to the homeowner directly. We give good quality HEPA vacuum cleaners to people. We give them green cleaning kits and instructions on how to use them with less toxic cleaning. We give them mattress mite covers and walk-off mats for their homes, air filters, humidity gauges. So as I was describing earlier, we've gravitated towards two different models, two very general models, as a way to structure this work. And the first of them involves some major interaction and partnership with a community health program, often the public health department, in some cases not, and a partnership with us. And the blue boxes I'm going to show you are the pieces that public health does for us in this model. So they will help us with outreach and referrals. They'll do the home visits with very individualized medication review, self-management goals in several visits in the home. And then on the far end, they will do follow-up to check on progress, help people go to the next step and document. And our pieces in this model are primarily intake and audit assessment specifically for healthy home elements that we can add and measures, as well as our regular weatherization and then the installation. So that's our public health model that we've been trying to test in our pilot project year and beyond that. This other model is basically does not involve public health partners, and we try to do with our own resources primarily the same tasks on a less sophisticated level because we are not health professionals, and we try to do that same outreach ourselves. We do outreach with community partners. We do the intake ourselves. We are not able to do the personalized community health worker visits, but we do the audit assessments, installation, and a small amount of follow-up. So quickly turning to kind of what did we learn from a couple years experience on this program. I won't read through all of these, but basically the takeaway is that there are some significant cultural differences and culture change that has to be worked on in order for a traditional weatherization agency to work intensely with a public health partner when we use that model that has their major involvement, and includes things from the overall orientation of the mindset of a weatherization agency being just on building science, energy savings, and the public health being on personalized improving health conditions and figuring out what an individual client needs in their day-to-day health. Assessments are totally different in nature as well. Client education is secondary when a weatherization is doing it. It's really primary when a public health entity is doing it. We find that our development of a scope of work is still in a weatherization agency tends to have to focus on the rules that we have to abide by and determining that we're getting a significant energy savings and it's cost effective, whereas the public health is looking at equity and needs of the individual, not so much on cost effectiveness. And unfortunately, one of the things that has not been as effective as we hoped is that the follow-up visits, when we're doing them through our weatherization agency by itself, has not been able to be nearly as comprehensive and data rich as the public health follow-up, which they are able to provide. So I wanted to give you quickly just a snapshot of some of the encouraging results we have seen, primarily more so with asthma clients than with COPD clients. And these are from data from Pierce County, one of our partnerships with one of those community health worker model public health agencies. And these come from the surveys pre and post that they were able to do. So they're finding that 86% of clients took 2 or more actions based on the work that had been done with them. And that 2 out of 3 asthma clients have reported improvements, and most of it has been significant improvements. These are based on the pre and post testing again. They're finding that 47% of asthma clients had significant improvements in their symptoms, their activities, and their mental health. And quantifying what that turned into medical usage, we found two measures of improvement. One was on the average per year, each client went to 1/2 of a smaller number of emergency room visits. They saw that they needed to go to the emergency room on the average 1/2 of one time less per year. And similarly, almost 1/2 of the time less per year needing to use urgent care. So what do we see in the future? We feel like the near term, we need to concentrate on mainstreaming the best measures that we have found to work in our traditional weatherization approach and apply them to all of our agencies. So add that other half of our agencies that are not currently doing specific weatherization plus health measures. We need to stabilize and increase state funding and keep looking for federal leveraging at as high level as we can. A couple further outlooks. We want to be able to, in the next few years, document our health impacts in a better way for funders and try to quantify those savings and add more public health medical provider partners and go beyond just the 4 community health worker setups that we have out of 14 agencies. And in the distant future, further out, the kind of gold standard is to be working towards Medicaid reimbursement for some of the services that we can document having the most impact. So in closing, I want to let you know that there are some other resources that you can go to. I've provided hyperlinks to our website for Plus Health on our Commerce website. The original implementation and lessons learned report that's pretty comprehensive if you're interested. The results in detail of the slide I showed you on our promising initial results for Pierce County, and a couple of those studies that Eric also referenced on quantifying and measuring health benefits. So thank you very much for joining this webinar. I hope some of this was transferable to the audience that's listening, and I'm glad to have people call or email me with follow-up questions. And I will turn it over to our next presenter, Jamal Lewis.
Thank you. Thank you, Tim. Just making sure you all can see my screen. Yeah, thank you, Tim and Eric, for the introduction and for that example. I'm just going to go ahead and talk about a few other examples of efforts attempting to integrate health and energy. And yeah, in the interest of time, just get right to it. Okay, so the issue that we all have, I mean, we all know that, and the evidence is clear that energy and health, that there's connections there, and that, you know, it's better to implement a comprehensive program that does both energy efficiency and tackles healthy homes issues. But the issue we all have is, you know, where are we going to get the money from to do that? And so this slide shows different resources available that to dedicate towards improvements in housing quality, including energy efficiency and healthy homes. And you can see that the 3 with the arrows are the 3 most prominent. HUD has the Lead Hazard Control Program, and the CSBG. DOE has the WAP program, and LIHEAP's under the HHS department. And so now I'm going to go into the model in which a lot of the examples that I'm going to talk about employ. And so because there are, you know, different resources for different parts of upgrading the home and home household upgrades. What we do in our direct service in Baltimore, and what we advocate for around the country, is for braiding of resources from philanthropy, government, private sector, and braid those, coordinate these resources and have them directed towards the home. And so we also employ a single intake system. So no matter where you're being referred to, you're able to come into the system. You get a comprehensive assessment, and which determines what resources you need and what resources you're eligible for, and then coordinating those services and conducting interventions. And what this model requires is workers, as Tim mentioned, that are cross-trained and able to do energy audits and healthy homes assessments. And again, so when we determine that you are eligible for housing upgrades, or that we determine in your assessment that you are in need of services for your home, these are a list of some of the services that we provide. So lead hazard control, hazard remediation, asthma trigger reduction, pest management, energy efficiency, and a lot. So the first example that I'm going to discuss is the Healthy Homes Technical Study that is a study of our program in Baltimore, study that was funded by the Department of Housing and Urban Development. And the purpose was to assess the cost benefit of providing both educational services and home intervention services. To assess the cost benefit of that, assess the health outcomes in terms of Medicaid, the health outcomes from Medicaid, and just realized that my presenter view is up. Thank you all. And to evaluate how the outcomes of these services. And you can see from this picture all of the partners that were involved. So you have Johns Hopkins, the prominent hospital in the area, AmeriGroup, which is the prominent health insurer where a lot of the clients were referred from, BGE, which is the utility, the Hilltop Institute at UMBC that helped us conduct the analysis. So we want to thank all of our partners for their help. So to begin, I'm going to run through how the program was run. So when a client was referred, they would be connected to the intake coordinator, again, which is the person who coordinates the initial home visit for the energy auditor and environmental assessor, and a community health worker or public health nurse who would implement the asthma pre-survey. And I'm not sure if I mentioned this, but this was specifically for AmeriGroup's asthma patients. And so most of these clients were asthma patients enrolled in AmeriGroup. And so the intake coordinator would coordinate all of those initial scheduling, and then the environmental assessor would go in and perform an energy audit and assess the home for environmental health hazards. And while the assessor is doing that, the environmental health educator is going to meet with the client, go through and discuss ways to mitigate and self-control asthma symptoms, distribute HEPA vacuums and other allergy reduction resources, and develop an asthma action plan to help the client manage either their or their child's asthma symptoms. And during the initial assessment, we have a pre-intervention survey that's conducted. And so a lot of the data that you'll see later is a comparison between the information collected at the pre-intervention survey and information collected at follow-ups. So Tier 1 services, so every client that was referred into the program receives Tier 1 services, which are essentially home-based education, basic supplies for asthma management, and related items. So this involves 3 home visits from the health educator, which is often supervised by a certified asthma educator, and which may also involve follow-up from the primary care physician and other care managers. And these visits also involved 3, 6, 9, and 12-month health surveys, some of which are implemented during the visits, and some of which were implemented over the phone. And then Tier 2 services are the services that we're all invested in. So these are actual structural improvements to the home. So it can include mold remediation, again, structural repairs, which can include energy efficiency and weatherization. Yeah, and you can see a lot of those Tier 2 services there. But that's just the terminology that we use. Tier 1 generally refers to, education and services of that sort, and Tier 2 refers to actual upgrades to the home. So here's some information about some demographic information of the clients that enrolled in the program. You see most of them were female. You have a wide variety of age ranges, education levels, employment status. Most of the clients were Black or African American, and most of them spoke English. And overall, we got about 270 clients that are included in this data analysis. Here are some of the key characteristics of the initial home visit. Most of the clients owned, although we did have some that rented. Most of them were extremely low income, which is less than 30% area median income. Most of them were not disabled. And prior to the visit, about half of them had existing asthma action plans, and about half didn't. So here's some additional data for all the statisticians out there. You can see that a lot of these measures were statistically significant, such as ER visits, physician visits, calls to physicians, and work days missed. In addition to health outcomes, we also, as a part of this study, measured non-health outcomes as well. So the energy-related data is still being analyzed, and we also did school and educational outcome data that was included in the surveys. As you can see, there's some pretty big percent reductions here. And so these interventions and services were, pretty effective in reducing healthcare utilization and increasing the ability for both parents and children to attend school. Here's some more data on the program, broken down by level of intensity of the intervention. So for individuals that received only Tier 1 services, and the difference between individuals receiving Tier 1 and Tier 2 is based on the assessment. And so if during the assessment we decided, or the environmental assessor decided that actual home interventions were needed, then they would receive Tier 2. But if the structure of the home was fine, then they would only deliver Tier 1 services. And here's an analysis of overall Medicaid expenses. You can see, none of the measures here were statistically significant, but you can see that the treatment effects were pretty large. And so perhaps some of the uncertainty around the confidence could be due to sample size or other factors. But analyses like this study and a number of previous other studies that we did in Baltimore, as a result of that, we were able to recently execute a contract with a Mayor group to perform services to their asthma patients. So it's clear that these interventions work, but we have to keep building the data and keep pushing for increased access to data and more resources to devote towards the home. Another example of an initiative looking to link energy and health is the Connecticut Green and Healthy Homes Project. So this is a very stakeholder-driven project that is led by the Connecticut Green Bank and the Connecticut Department of Public Health to develop a program where clients are able to access both healthy homes interventions, energy efficiency, and other community-based services that are needed. And so here you can see a number of statistics that make the case for a program like this. Residents spend about $5.2 billion a year on utilities. The average income or the average energy burden is 60%, which is much higher than the national average. So we talked about asthma, but trip and falls are also a condition that is associated with both energy and poor quality housing. And in addition, they're also targeting children who have been diagnosed with lead poisoning as well. At the time, so this is a statement from the Connecticut Green and Healthy Homes needs justification, which again outlines the need for a program like this. And here are a list of the partners that are involved. Again, the Connecticut Green Bank, the Department of Public Health, Connecticut Department of Housing, Eversource. And we thank you all for your participation in this project. And and we are in the process of pilot design, and so in that process we have talked to over 100 stakeholders, including state lawmakers, healthcare advocates, health systems, energy efficiency programs, both utility and state, to help better inform the pilot. So the program will be, like I mentioned earlier, will be structured similarly, where you have intake and enrollment. You have the initial home visit performed by the Healthy Homes educator, who will, and the assessor, who will come up with a scope of work, and then the work will be completed, and then we'll evaluate outcomes. But the key question is how these interventions and services will be paid for. And so Connecticut has a really cool opportunity to have to get investment from the healthcare community. Connecticut is unique in that it does not have managed care that a lot of states do have, and so the Medicaid program is run essentially through the state, which creates a tremendous opportunity for the state to collect the savings from less healthcare utilization as a result of these services being provided. Skip that one. So there's two elements to the program design. There's the operational side, which is how the services will be delivered, and then there's the design of the payment structure. And so simultaneously, we're kind of working through what the best way is to to design both of those aspects. And in a way, one informs the other. But again, we're talking with stakeholders to figure out which method is the best for the people of Connecticut and for the stakeholders there in Connecticut. Again, now we're in the pilot design phase, but the first phase was determining the feasibility of a statewide model for housing, health, and energy services. And after the pilot design, the next step would be to implement the pilot and collect data and evaluate. Yeah, and so this is the last example that I'll go over. So we have a project also happening in the city of New York, where we are structuring the first of its kind asthma program that's connecting healthcare funds to prevent asthma exacerbation. It's launching in mid-2019. And the purpose is to utilize Medicaid funds and create this sort of sustainable structure where Medicaid can invest in these sorts of services and reap the benefits on the back end. And so we're doing that through two mechanisms, which is value-based purchasing, where Medicaid would pay based on a previously determined outcome. So if it's reduction in hospital visits, Medicaid will pay for achieving a reduction in hospital visits. And the other is through pay for success, which is another mechanism, but one that the state Medicaid office will not have to take the risk of investing on the front end, but instead there's a private investor who sort of makes that initial investment, and then Medicaid will pay again based on value, based on reductions in hospital visits. So here's a diagram of how that'll work. In the interest of time, I will move on. I believe these slides will be shared, so you'll be able to look at these. Here are other projects. So in City of Illinois, ComEd, the utility there, is looking at also performing a Healthy Homes pilot, where they're going to they plan to deliver coordinated interventions to at least 20 families in 2 multifamily buildings. The Tennessee Valley Authority is invested in reducing the number of deferrals due to health and safety hazards, and so they are brainstorming and thinking of ways to tackle those health and safety hazards so they can deliver their energy efficiency services. And there is a coalition of folks known as Energy Efficiency for All, which is a partnership across 12 states that are looking to get more investment in energy efficiency services for low-income multifamily residential buildings. And part of the strategy there is to show that energy efficiency and weatherization can that those services have a greater impact than just reductions in energy costs, so that more investment can be so that we can get more resources and more investment for these services. That is all that I have. Thank you all for listening, and now we'll take some time for questions. So if you have questions for myself, Eric, or Tim, feel free to use the chat box, and we will answer. Do our best to answer.
Yeah, thanks, Jamal, and thanks to all of our presentations. That was great. I'll read off some of the questions that we've gotten so that the rest of the audience can hear what the questions are and kick them to one of you for answering. We also, since we're coming up a little bit short on time, I think it's fair to say that if there are any really pressing questions that we don't get to, the presenters can triage afterwards and maybe provide some brief email responses to those people. So Jamal, we have a question for you. in the projects that you were looking at, was there data collected on actual asthma trigger reduction, such as allergen dust or air sampling? And if that wasn't able to be done, could you elaborate on why?
Yes. I believe that there was data collected on that, but I can follow up with that person. If you send me their information, I will follow up and connect them with my colleague who coordinated that program.
Great, thanks. So for Tim in Washington, looking at the Washington Weatherization Plus Health program, there's a question: are any of your utilities involved at the program design level, or are they taking an active role in program support?
Thanks for the question. Yeah, they have not been involved in the design phase of the Weatherization Plus Health development. They are supporters indirectly through being funders of that the funds that go through matchmakers from the capital budget in the state. So that state dollar is matched by a utility dollar, which then becomes part of the funding stream that we draw on for spending Weatherization Plus Health. But there's no direct planning involvement at this point. There's interest, I think, and further down the road we may involve them, but not now.
Okay, thanks. Another one for you, although I think maybe the others, if you know of other case studies where this is relevant, could answer too. How do you deal with overcoming HIPAA restrictions to record and share data on client health kind of among partner agencies, or is that a concern?
That's a great question, and it's one that we've had to spend a fair amount of time in the last year or so addressing. And yes, it is a major issue for the service providers that they feel comfortable that we've designed this in a way that meets privacy standards, both either whether HIPAA applies to them or not, and meets state law standards, and it's a work in progress. I think we've approached it as both part of it is responsibility of the local provider organizationally to answer questions about HIPAA, decide whether they are whether HIPAA applies to them or not. But we've also taken the approach of providing some standardized approaches to getting client waiver of their privacy rights on very specific bits of data that we use for evaluation. And that's been done in common for all the agencies providing services as well.
Okay. A question for the presenters in general. Is anyone performing radon testing before or after weatherization, or is there other ways that Weatherization Plus Health could address radon?
I can take this one. So the Department of Energy updated its health and safety guidelines for the 2017-2018 program year. So radon remediation is not part of the Weatherization Assistance Program. However, the health and safety guidance of the Department of Energy has advises weatherization grantees to install precautionary measures to address radon, namely ground vapor barrier covers, those ASHRAE ventilation fans, to name a few, and some pump covers as well. So in the most updated health and safety guidance, DOE has advised to take precautionary measures against radon, but mitigation and testing is not part of that. But certainly in the Weatherization Plus Health model, they could bring in a radon remediation contractor with some leverage funding. That's not happening on a, I don't have a case study to give you on that, but certainly radon is a concern that the weatherization program is aware of.
Great. And then another kind of question for the general presenters. Besides local health departments, could someone elaborate on other partners that are directly involved in weatherization plus health?
I can give a partial answer to that. For Washington State, one of our other partners is in Eastern Washington, in the Yakima Valley, and there is a very sophisticated network of health clinics for low-income folks up and down the Yakima Valley. They've had a very sophisticated asthma program, and we've joined our resources in Weatherization Plus Health to do the weatherization part of the approach to the houses that they find at most risk. And so, yeah, they're an example of a nonprofit medical partner who we've partnered with.
Great. And then I guess we'll do one final question, and then, as I said, we'll try and address the rest of them in follow-up to people who asked them. But in general, what kind of % of the work is being done in multifamily properties versus single-family?
Yeah, I guess I can start there. Most of the work generally is done in single-family. Multifamily is a lot more difficult, because you have to get the building owner approval for the work, and a lot of times it's hard to either find the building owner or they're unresponsive. So most of the home upgrade services or interventions are done in single-family homes. And Sarah, I just wanted to really quickly address the question that was asked earlier about environmental sampling, such as allergens and dust samples. That testing was not done. I confirmed with my colleagues that testing was not done. The cost is over $350 per client, and we were, essentially wanting to keep costs low. And since we were conducting a benefit cost analysis, we determined not to.
In regards to the multifamily, and when you're talking about the Department of Energy's Weatherization Assistance Program, there is a significant amount of multifamily housing. So the weatherization programs in all housing stock, single family, multifamily, and a lot of manufactured mobile homes as well. Certainly a lot of the multifamily is concentrated in certain states, think California, New York, Illinois, but there's a lot of multifamily that happens, and I'd be happy to give you some resources and profiles of some states that are doing a lot on multifamily side.
Great. Well, that brings us just a little bit over time. So I'd like to thank everyone for coming and for submitting good questions. And thanks especially to our three presenters for providing a lot of really great information. A recording of the webinar will be shared with all attendees and posted online. So you can feel free to share it with other people who may have missed it or go back over sections for more information. So thanks everyone for coming, and have a great rest of the day.
Thanks, Sarah. Thanks, everyone.
Thanks, everyone.
Thank you.